the healthcare service providers have been cautioned against denying National Health Insurance Fund beneficiaries health services. Acting NHIF Chief Executive Officer Dr. Samson Kuhora is urging the providers to uphold their contractual obligations as government works to ensure speedy payments of funds.
In recent weeks, NHIF-approved healthcare providers have been accused of turning down patients owing to non-remittance of funds by the Health Insurance Fund. It is this emerging trend that the acting NHIF Chief Executive Officer, Dr. Samson Kuhora, is questioning healthcare service providers against.
I would like to mention that this is actually a violation of the contractual provisions that we have with the hospitals. They've raised the concerns in terms of payments, but we have contractual obligations, and we made it very clear that payments is a continuous process.
Kuhora, who was in Kisumu for a two-day consultative meeting with leadership from the Central Organization of Trade Unions, said the new financing model is cost-effective and will ensure patients with chronic illnesses will access medical care.
Some of the challenges that we are having is in terms of the cash flows coming in. So there are several initiatives that we've taken up.
At the same time, he said the government has shifted its focus towards preventive health as opposed to curative services to reduce the cost of treatment.
For example, cancer management. Most of the cases are presenting in stage 3, stage 4, where the intervention is significantly more expensive and it's more intensive, so the outcomes might not be as good. So by having early interventions, we are able to get better returns on what is being spent out.
Additionally, the fund is looking into ways of sealing loopholes that have seen incidences of medical fraud thrive over the years, crippling the national health insurer financially. So
there is an ongoing exercise on employer compliance. It's expected to take about 3 weeks, and the net effect of it is that we expected to generate about 712 million in revenues from those employers who've not been compliant over the last 3-4 years.
By making sure that they seal loopholes of spillage of public funds so that NHIF remains a formidable organization to.
The health insurer has asked for patience among service providers as it settles claims. For Prime Edition from Kisumu County, I am Wycliffe Okech.